With parts of Ontario moving to stage 2 starting June the 12th, what are some of the precautions that we can take? With more on this, I'm joined by CTV's medical specialist, Dr. Marla Shapiro. Good morning, Dr. Marla.
Good
So,
morning.
what can we do? What should we look for as we enter a business to ensure that that second stage in Ontario doesn't happen sooner rather than later?
I think the most important thing is that we don't get complacent. So the recommendation to wear face masks when you're in an area where you can't social distance for the recommended distance, I think that holds, and I would strongly recommend that. Washing your hands, not touching your face. None of that changes. Yes, there's less community circulation, which is good news, and we've learned a lot about the difference between asymptomatic and pre-symptomatic transfer within the community. But still, I think you want to do as much as you can to maintain that social distance, because I don't think that there's zero risk right now.
Okay, a lot of people in the Greater Toronto area will want to visit cottage country. Does opening regionally put some communities now at higher risk than others?
So that's a very good question, because you can see that in some of those areas, they've moved on to phase 2, while here in metropolitan Toronto, we have not. So if you are going, the recommendation has been not to go. But if you are going to go, respect the fact that you're coming from a city where there's higher transmission and you do not want to be bringing illness into their community. So I think that you want to bring all your food and everything that you need with you from where you're starting out to where you're going. You want to stay out of their grocery stores. You want to stay out of their community, because you're still coming from an area that's higher risk. We've been asked not to do this, but there are many individuals who miss their homes in the countryside, and they will be. And I think that that's what you have to keep in mind.
I think for most people in Toronto, Golden Horseshoe, Windsor, they weren't really surprised to see that they weren't able to move on to stage 2. What are you watching for in terms of the data to be able to get to that next level, Dr. Marla?
Well, we are a densely populated area. All of those areas are, so it makes sense that we would see higher transmission. So we need to see what we've been talking about right from the beginning. We need to see the numbers go down. We need to see them being sustained as they go down. We need to know our hospitals are not overwhelmed. We need to see that trend towards decreased transmission. The World Health Organization told us yesterday that truly asymptomatic people, people that we don't even know who have had it, those are not the people who really have the chain of transmission. Those aren't the people that put other people at risk. It's those people who are pre-symptomatic, meaning you're out and about and a few days later you become ill. During the few days before you developed your symptoms, you're infectious. So that doesn't change. So we want to keep all of that in mind. Even though the numbers decrease, we'll need to see more in these densely populated areas before we can move on to phase 2.
Okay, Dr. Marla, thank you so much. We'll talk to you again next week.